Thank you. Seeing no other witnesses in opposition, we can entertain any questions or comments from members of the committee. Assemblymember Baker.
Yes, please. Thank you, Mr. Chairman. Mr. Cooper, can you please address the question regarding the definition of tobacco and just address one of the main points that was raised? I could benefit from that.
Well, I think it's very interesting that our speaker over here spoke about vegetable or plant products being used. I've never heard of that. And while some of those vegetables may contain nicotine, nicotine primarily comes from tobacco. That is what is used. And it's funny that 95 cities and counties in California already have some type of e-cigarette regulation. And many of the counties and cities these folks live in and come from already regulate it. So it is a tobacco product. Nicotine is the addictive portion of it. Bottom line, no ifs, ands, or buts about it. I spent 30 years as a police officer and 10 years working narcotics. Nicotine is addictive. That's why those laws were passed with tobacco. Sure, it's been extracted from a tobacco plant, but it's still highly addictive with it. And it's just disingenuous when these folks say that it isn't. And one thing I do support is cessation. It's a great job. Instead of smoking cigarettes, it's much better. But the fact is, it still contains nicotine. And that's the bottom line.
Just a little bit follow-up.
Please.
And you mentioned the counties throughout California that already do this. Does your bill in any way affect the ability of local jurisdictions to choose their own path in this regard? Let's say if they want to have something more strict or...
It would allow for that.
Okay. And the final one is, what are other states doing in this regard? You've probably had an opportunity to sample that. Can you...
There are quite a few states that have regulated. It's just really all over the board. And right now it's the Wild West. The FDA does not regulate it. Some folks spoke about some of the e-cigarettes that supposedly don't contain nicotine. Well, the FDA has done some tests and actually found nicotine in some of those devices. So really it's unregulated. Everything we eat and drink is regulated by the FDA. There's some law addressing that. With this, there is no law. So it's up to that individual manufacturer. And while most of them, I'm sure, are good businessmen, you have some that aren't.
I guess what I was getting more to is, have you seen, and there may not be any studies on this, if a similar statute has had the effect of helping or hurting cessation?
Well, the bottom line, and I guess it comes down to, if this passes today, this bill goes through and passes, what does it do? These folks can still buy their vape cigarettes. Nothing changes. This puts it in legislation where it defines it as a tobacco product. So to me, in my mind, it doesn't really change anything. They can still buy it. They can still sell it. So
maybe there isn't. It may be that there's no study out there that has looked at what the experience, the effect that these laws have had on the use of smoke tobacco. That's really what I was curious about. If in preparing this bill, if you've looked at that, and I'll tell you, I'm leaning towards supporting your bill. So okay. I'm not trying to set you down a path.
I didn't think that.
It's more along the lines. But I am curious if you've seen from other states that may have had any regulation of e-cigarettes similar to what you're proposing, if it has had an effect, positive or negative, on cessation.
Sure. There have been other states that have passed legislation that's fairly similar to this. We know in California, with 178 cities and counties that have passed e-cigarette regulations that do treat e-cigarettes like a tobacco product, it has had an effect in terms of the sort of renormalization of smoking behavior. Having children watch grown-ups smoke, use e-cigarettes in restaurants, in, public places where people gather, has a detrimental effect. To your specific question on whether or not there are studies that have shown an ordinance or a state law that treats e-cigarettes specifically as a tobacco product, I can only tell you what we know in California, and that those cities and counties that have passed this, we are seeing the sort of explosion of e-cigarette usage, all over the state, and it's definitely time to act in California. And those cities have certainly seen the explosion is tempered, shall we say.
Any other questions or comments from members? Dr. Wood.
Yeah, this is my question. A couple questions for the people opposing the bill there. I believe it was you, sir, that said that there really hadn't been a dramatic increase in the use of these products by young people?
There absolutely has been an increase in experimentation of vapor products among young people.
But you said it was they'd try like one cigarette and then they'd be done.
What I was saying was that there were 2 points I made regarding youth smoking, which was there's been a rapid, dramatic, record decline of 40% in teen smoking in 2 federal surveys between 2011 and 2014, and also that the study that was brought up that was published in JAMA last week that is being used to say there is a gateway effect from vapor products to traditional cigarettes. The authors of that study have come out and said that that's not a proper conclusion to draw, because all they did was see, okay, of course, somebody who's willing to try a vapor product is the kind of person that's going to be willing to try a cigarette, and they'll be more willing to try a cigarette than somebody who won't even try a vapor product.
A couple other follow-up questions through the chair. You said there are lots of other chemicals in these vapors. There are, and I think it would be hard to deny that. When someone exhales this, you see this vapor. There are other chemicals. I'm not aware of studies that have been done to say whether they're harmful or not. But I believe one of you said the vapor is essentially harmless. But then you, I believe, said that it's 95% less hazardous, which implies that there still is a hazard. Correct?
That was the 2 authors of the Public Health England report essentially giving a worst-case scenario for the future. And that is worst-case scenario for the user. And what we do know is that inhalable medications, like the Nicorette inhaler that's made by Pfizer or GSK, there are international standards for what levels of different chemicals are allowed to be present in the vapor, in the mist that comes off of inhalable medicines. And the levels for the actual user, even assuming that the user is taking 600 puffs a day, which no one in this room actually does, the levels are below, for the user, what is allowed to be contained in an inhalable medicine. So then you're talking about bystanders, where it is a minute amount that the user is actually exposed to versus the bystander. So absolutely, there are chemicals, but there are chemicals in everything. I was in Starbucks this morning. California, perhaps more than any other state, has done more to miseducate its citizens through Proposition 65, because in Starbucks they were warning me about carcinogens. In the car rental place, they were warning me about carcinogens. No one in this state, as far as I know, actually pays attention to those signs anymore, because they recognize, yeah, everything has chemicals. It's the levels that matter, not the mere presence.
And one final question. Thank you for your interesting. Sounded like rain. I believe I understood that one of your primary, and it could be coming from both of you, your primary objection to this bill is that this defines e-cigarettes as tobacco products. Is that fair to say?
Yes, correct.
So I come from a city where when I was the mayor last year, we actually passed legislation in the city of Healdsburg that did not define e-cigarettes as tobacco products, but we defined them. What we did was we by statute, by legislation, created a situation where they were treated like tobacco products, exactly through the same mechanism that we do for other things. So I'm curious, would you object to that? Because if your assertion is that it's the definition that bothers you, I wonder, I'd love to hear what you have to say about that.
Of course, if this bill was amended to make vapor products non-tobacco products, to put them in their own category, it would be better. But there is a vast difference between the kinds of regulations that local governments enact.
So I guess the answer is no.
The answer is the bill would be a heck of a lot better, but we'd still like to work out some kinks.
Okay, thank you.
Thank you.
Additional questions or comments from members?
Mr. Chair.
Yes, Mr. Garcia.
I know that it's been alluded several times, this public health study done by the United Kingdom, and from what I've read in the executive summary, I'd be lying to you if I said I've read the entire study. It does 2 things, I think. It says, one, that the use of vaping e-cigarettes are less harmful than your traditional cigarette. And then it also, in my opinion, does not highlight a couple of things that I think are extremely important, and that's the data that would say here are the long-term impacts of vaping or utilizing these devices. And to me, where I get stuck here is where it does not give it a clean bill of health saying that it is not harmless. What I think of when I get to that point is that it is said that 500,000 people, I'm going to estimate, give or take, die from smoking cigarettes in the United States. So the number of 95% less harmful, if I'm looking at it from the standpoint of people's public health and fatality rates, that would mean that only 26,000 people would die by using this type of device. According to the study that the United Kingdom has put forward, that it is 95% less harmful. So I get caught there where we have a situation where we take a zero risk position, or we lower the level, the threshold, if I may, for lack of term, in terms of the harm that it could cause if consumed. And so that's one. Can you kind of address some of those comments or points?
The vast majority of users of these products are either smokers, people inhaling burning smoke into their lungs on a daily basis, or they are ex-smokers who have switched. And I believe that if you had the two distinguished authors here before you today, they would not say that 25,000 people of the 500,000 per year, that they would actually die from vapor product usage. They are using that as the worst case scenario, the best number that would be easily understood by the general public. The general public tends to think in zeros and fives. If they say 97, 98, it's a little more confusing than just saying 95. I think that that would translate into, there have been studies on other products, a month off of someone's life versus, if you average a huge pool of people that have used the product, a month off their life perhaps, versus smoking where you have 6-7 years of 1/3 of the people who smoke plus many more.
So, the United Kingdom, which I think, and please correct me if I'm wrong, is a member of the European Union. I may be off there.
Correct.
In the European Union, many of the countries there have adopted far more stricter regulations.
And that has, I'm sorry.
And labeling as it relates to what these products contain, the limited amount of actual nicotine in these products, and of course the type of marketing that is done. My assumption is that you're probably not in favor of those types of regulations.
We would be perfectly happy to have the FDA step down with reasonable regulations on labeling, on good manufacturing practices, et cetera. We are gravely concerned about individual states doing this, because then you end up with 50 different regulations on labeling, 50 different regulations on what can be in the liquid, and that's disastrous for small businesses, especially those here today that don't have the resources of a large tobacco company behind them. And I'll add that in those European countries that have taken stiff positions, in the Asian countries that have pretty much banned at the advice of groups like those supporting these bills, smoking is not declining in the way that it is declining in countries like the UK, where you have stop smoking clinics actually offering support to e-cigarette users. I can't imagine in the United States actually seeing Cancer, Heart, or Lung say one positive thing about vapor products, let alone have their stop smoking services actually lend support to people looking to quit smoking.
Thank you. I wanted just to comment that I've had the opportunity to speak to a number of local business owners who are concerned about the added cost to the business. And one of the conversations that I had was, I'm not sure what type of price tag you put on public health and the lives of individuals. Assemblymember Cooper alluded to the industry. By no means, I believe the intention of this bill is to eradicate the business aspect of e-cigarettes and vaping. People will still have the ability to purchase these, just simply under a different criteria and umbrella in order for the purposes of regulation. And so, I've not heard anyone. A lot of the comments and conversations have been, I won't be able to stay in business because of this policy in shifting it over under the tobacco legal codes. Can you kind of
I think the point of this bill is that it continues the campaign that the California Department of Public Health started back in January, where they started running commercials misleading smokers and misleading adults into believing that vaping may be as hazardous as smoking. That is the goal of these groups, is to make adults believe that the jury is still out on whether vaping is any different from any other tobacco product. I think that's morally wrong. I think it's scientifically wrong. And that is their goal. That has been their goal since 2009, when they tried to get the FDA to ban these things to adults.
But that would be in line with the public health report from the United Kingdom, right? That the jury is still out in terms of the public health implications, right?
My apologies for interrupting. No. The jury is still out on exactly whether it's 95%, 97, 98, 94%. There is no doubt, and even some of the most virulently anti-vaping researchers at the University of California, San Francisco, even freely admit, if you prod them a little bit, that yes, obviously, using a vapor product is far less hazardous than smoking.
Let me just close by saying that I certainly support those individuals who are here and who have, shared in the past and in the more recent conversations that this has changed their life, that this has improved their health, that their marriages have improved, and that they've become better role models for their children. But it doesn't change my outlook from the standpoint that there is still some harmful contaminant in these products that is really at the core of the conversation today. So I just wanted to close with those comments. Thank you.
Other comments or questions from members? Assemblymember Thurmond.
Thank you, Mr. Chair. I want to thank the author for bringing this bill. I want to thank those who've testified in support and against, and for all those who've come here to speak, because this is not an issue that is clear, very, very much so. I'm no expert on it. I got a lot of questions, and I appreciated hearing all the perspectives and from all the. I think the entire industry was here today, so thank you for sharing. I'm happy for all the folks who said that this has helped, that e-cigarettes has helped them to stop smoking. I do have some critical questions, though, because I think that this is a serious issue and is impacting young people in a serious way. And I really like the nexus that the author of this bill is making between potential harm for children as it relates to e-cigarettes. And so I'm going to ask some questions, particularly to the opposition, about things that I have read and heard that seem factual and I think we should discuss. First one is, isn't it a fact that e-cigarettes contain nicotine? And if that is true, shouldn't we be passing this bill and doing everything that we can to keep nicotine out of children's hands?
We should be doing things to keep nicotine out of children's hands. That can be done without defining these products as tobacco. And also, unlike the FDA has stated that if a product, a component, or a part of a vapor product does not contain nicotine, they will not be regulating it as a tobacco product. That's in their deeming regulation that came out last April. But this bill would make even non-nicotine products, devices, just batteries that people sell, they would become tobacco products, but under the FDA's rules, they would not be. So I just want to make that
it's
clear.
A good argument, but my guess is that no one's going to buy the vaping device without buying what goes with it.
That's incorrect.
Why? Why would somebody?
My colleague here could tell you better than me, but there are many vapors who step down off of nicotine. There are people who want to quit and they want to get off nicotine immediately. My colleague would like to add something.
Happy to hear it.
Thank you. So as a business owner with a retail vape shop, approximately 10 to 15% of all the e-liquid that we sell contains no nicotine, and we've seen a dramatic trend in the 2 years that we've been in business to where people have made a shift lower in nicotine, and now they like to. Having a huge component of how electronic cigarettes help people quit is because it mimics the hand-to-mouth motion, the habit of it. Mm-hmm. And so even when people have weaned themselves down, they still like to continue participating in the habit. However, they are celebrating not using non-nicotine products. So it doesn't make sense at all to me to classify a non-nicotine product as a tobacco product under this bill.
Let's continue with that line of thinking, and that's very helpful to know. But as I've been reading some studies about when young people use e-cigarettes, mostly many have said that they've never tried traditional cigarettes before. And so in the case of young people, they wouldn't be buying the vaping devices to step down if they have never smoked a cigarette before.
What we're finding is that, yes, there are large swaths of youth that have tried vapor products and have never smoked. But when you actually start to boil it down, look at past 30-day usage, and then go further, the 2015 California Healthy Youth Survey, as well as other surveys that are being done across this country now, are actually looking at times of the month, days of the month, that someone has used a vapor product. And when you get down to where there's actual habitual use, over 10 days a month, 95% plus, 90% plus, 98% plus in some states are either smokers or ex-smokers. So there is a vast difference in the literature about nicotine gum, patch, lozenge, other smoke-free nicotine products, where they've given them to people with Alzheimer's, with people with other diseases that may have some benefit to nicotine. They don't develop a dependence. There's a vast difference between inhaling burning smoke, literally freebasing nicotine, and a vapor product or any other smoke-free nicotine product.
And if I may, the studies actually don't differentiate whether these children are using products that contain nicotine or no nicotine. So theoretically, every single teenager who's been in this study has vaped a product with no nicotine. So the study isn't well-rounded or accurate because it doesn't even differentiate whether nicotine is used by the youth.
Different question, but I'm going to follow on the train that you were just going about.
Please.
Can we talk about lung capacity?
Absolutely.
I just read, just now, as we were having this conversation, a study that says 10 minutes of smoking e-cigarettes causes noticeable change in airway resistance in the lungs. And so, again, I'm going to always come at you from the standpoint of, I think this is good for young people. And if we know that when things are exposed to young people that could put them in further harm's way down the line, I would say, as in this case, why not pass this legislation if we know that vaping creates resistance, airway resistance in the lungs, particularly for young people? I'm putting the lens of young people on it.
Sir, with all due respect, Dr. Michael Siegel, who's a professor at the Boston University School of Public Health, one of the original anti-smoking advocates who's testified against the tobacco industry, never taken a dime from them, he commented on that very study that I believe you are referencing and referenced another study finding that when people sit in a sauna for 10 minutes, that causes about the same level of airway resistance. That does not indicate any kind of harm. Short-term irritation does not indicate any kind of harm. And there's a great paper that I really encourage you to read, regardless of how you vote today. Lung Harm Reversal Polosa, P-O-L-O-S-A, an Italian researcher collected the evidence on studies that have followed vapors throughout months or years to look at their lung capacity, to survey them about their lung capacity. And you have smokers, people who smoked for 40 years, some of these people here today probably used to have an oxygen machine or used to walk with a cane. But because they get the same effect of quitting smoking, the lung capacity returning, even though they are vaping. That is what is happening in the real world, not in a clinical study that just looks at what happens after 10 minutes.
Thank you, sir. Did you have further questions? Two more. Okay, we're going to go. Assemblymember Thurman has his questions that he's wrapping up, and then Ms. Baker had one but doesn't. And we can entertain a motion now.
I'd like to move the bill.
We have a motion. We have a second. Thank you. Mr. Thurman, continue.
Thank you.
And then we'll move on.
I didn't read that study, but I'm happy to read it. When you meet me at the sauna, and we'll read it together. How about that? The last one really is about the flavors of vapor. And I have a hard time accepting that these are not products being catered to young people when there are flavors such as gummy bear or other flavors that appear to be geared towards young people. And it just seems to me that if we want to protect young people, we would do everything in our power to do so, including say that we pass this bill so that young people aren't getting access to these products.
Well, I would just add, before going into flavors, you can get the same effect as this bill, the sting operations, retail licensing, without defining them as tobacco products. On flavors, 5 years ago, August 10th, 2010, I quit smoking with a watermelon-flavored vapor product. And since then, everything that I've used has been a flavor that opponents will describe as child-friendly or intentionally marketed to attract children. Today, I have mango. If you ask this room, if you are using something other than tobacco or menthol, are you using gummy bear or a gum or anything of that sort that they want to falsely paint, which has been something going on for 6 years? We have a great study, a survey of 4,500 adult vapors, finding that 70% plus their main flavor was either fruit or something sweet, and that they rated flavor availability, as extremely important in staying smoke-free. And so flavors are incredibly important, and I would urge you to talk to some of the vapors in your community, the people that have quit smoking, and ask them what they're using, and I think many of you would be surprised.
We don't agree, but I appreciate your discussion of the facts.
Thank
today.
you, sir.
Thank you.
Thank you. We have a motion. We have a second. Assemblymember Cooper, would you like to close, please, sir?
Please. First of all, I want to thank all our speakers for coming out here today. I truly appreciate it, and it is a cessation device. The folks that have got off tobacco products, I applaud you. It's tough. Nicotine is addictive. It's hard to get off of. So I think it's a good thing you're off of this. This is really about our children. And the speaker to my left said it. Large swaths of youth try e-cigarettes. And that's the bottom line. And you can say tobacco, whatever, it's still the product in tobacco is nicotine. That is very addictive. You know, we want to make sure our kids have a chance to grow up and not experience this. It is an issue right now. You go out in the streets, you see a lot of e-cigarettes, a lot of kids smoking e-cigarettes. A lot of your operations for alcohol and cigarette buying, underage decoy operations, they involve cigarettes for a reason, because kids are buying cigarettes. That's why we're doing those programs, because they do consume it. And this makes it more appealing, more attractive to these kids. And young kids, especially teenagers, are easily influenced. And some of these names do influence them. And the bottom line, this bill, you can still buy e-cigarettes. It doesn't change that. You can still sell e-cigarettes. You can still smoke e-cigarettes. What does it change? The definition, the legislation, nothing else. So the rules today remain the same except for the legislation. So I really don't know what the big deal is. We're trying to protect our kids. That's the bottom line. So I respectfully ask for your support for this bill. Thank you.
Thank you, Mr. Cooper. We have a motion of due pass as amended to finance. It's been seconded. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Baker?
Aye.
Baker, aye. Bonilla? Campos? Eduardo Garcia? Eduardo Garcia, aye. Levine? Levine, aye. Mays? Santiago? Santiago, aye. Steinnorth? Steinnorth, no. Stone? Thurmond? Thurmond, aye. Wood? Wood, aye.
The bill passes with a vote of 8-1. Thank you, Mr. Cooper.